Marvin Plackett, and today is Thursday, July 23rd. Greetings to all residents, to all staff, to all guests, worldwide friends. We now have 4 active cases of COVID-19. So one of the residents, the person that was at Episcopal Church Home on our 2nd floor dedicated COVID unit, that person has now been transferred back to their home, which is the Gardens. So we're delighted about the recovery of that resident. So welcome back to the person, and I actually don't have their name, so otherwise I'd mention your first name. Sorry about that. Anyway, delighted though to see that that resident has fully recovered. So we continue to have 1 resident now. Yesterday we discovered that 1 resident at King's Crossing has COVID. They're currently in the hospital, and we of course are hopeful that they will have a speedy recovery. And then we continue to have 3 staff that remain active. So again, a total of 4 cases at this time. So yesterday, as you know, a big day where Governor Walz, he announced a mandate for face masks indoors across Minnesota. So 2 headline stories in the Star Tribune. Governor Tim Walz mandates face masks indoors across Minnesota. The other article, Minnesota businesses see advantages in statewide mask policy. Many businesses are delighted that this step has finally taken place. I personally am also very delighted. It benefits our organization overall, but the retailers, Minnesota businesses, they're really pleased so that they aren't standing out there on their own so much, but rather they are now able to say, this is a statewide mandate. And so pleased that this significant change is occurring, and of course, as Governor Walz said, it's effective on Saturday morning, first thing Saturday morning. You know, on public radio this morning, I heard an interview where a person, I don't remember where they live in Minnesota, but in any case, they said that they are not going to cooperate with the mandate, that they do not view an executive order as law. You know, the thing about this virus, it doesn't care whether or not a person believes that an executive order is law. It doesn't matter, this virus doesn't care if a person is a Democrat, a Republican, or an independent. It doesn't care at all. This virus is going to seize every opportunity that it can. And it doesn't matter if a person believes that the virus is real or not. The virus is going to do its thing and grab onto and seize every opportunity. It was 2 weeks ago that I mentioned a case, it was written about in multiple papers around the U.S. A person in, I'm trying to remember which city it was in, which state it was in. I think it was in New York, but I'm not sure about that. In any case, in multiple papers where this person, 31 years old, he went to a COVID party because he did not believe that COVID is real. He contracted COVID. He is one of the few that got very seriously ill, ended up in ICU, and he told his nurse as he was laying on his deathbed, he said, I didn't think that COVID-19 was real. I guess I was wrong. And the next day he died. So again, you know, it doesn't matter if you don't think this is serious or not. This virus is going to seize every opportunity, and that's why here at Episcopal Homes we have been so diligent about establishing strict guidelines, policies, practices that we incorporated months ago. And and we of course have learned since we first incorporated practices in March, we've learned a lot. And we have evolved as our learnings have improved. And so the most important things that we can do to protect yourself and your loved ones and everybody around you is social distancing, staying at least 6 feet apart, which is 3 arm lengths apart, and wearing your mask at all times. When you're not in your apartment or you're not in your room, in your unit. Wearing that mask, social distancing, key things. If you have any symptoms, self-isolate, contact your healthcare provider, inform us, and stay away from anyone, get tested, and then, of course, should the regrettable happen where you have it, then immediately it's self-quarantine, or if you feel ill, like this person at King's Crossing, so ill that you know you need urgent care, then of course the hospital is the route to go. But a number of residents, like at Seabury, we had 2 last month, or the month before, they did not need to go anywhere. They just self-quarantined, and they recovered, and all is good. But in any case, the point is, back to the key features that we need to be practicing all the time, and that is social distancing, wearing a face mask. If you feel any illness, self-isolate, get checked, and if it's positive, then of course we do immediately contact tracing to figure out who else has been exposed and to get those tested as well. Frequently washing your hands. If you're going to get together in any groups, make sure they are small groups so that you can socially distance effectively. And then, of course, outside is better than inside. Yesterday, there was an example of this, okay? Yesterday afternoon, there was a beautiful memorial service for a resident who died 10 days ago at Episcopal Church Home. And the service was held, memorial service was held at Iris Park, the city park, which is just across the street from us, just across Lyndhurst. Beautiful ceremony, magnificent. The family's involvement, engagement, the touching stories that they told, reminiscing about the dynamic mother that they had, grandmother, etc. It was just a beautiful ceremony that I was so glad to be a part of. And of course, we all felt great participating in this because we practiced social distancing while we were outside. And so nobody felt threatened or scared to be a part of the ceremony. We all got to have this wonderful, joyful experience of hearing from the richness of the family. So let me wrap this up by saying thank you for your vigilance. It really matters. And now, of course, wearing face masks is a statewide mandate. It's not just a principle here at Episcopal Homes. Statewide mandate for gathering places inside. So anytime you go shopping, anytime you're places of worship, etc., face masks are mandated, and it helps all of us. We're all in this together. We all need to be vigilant. We all need to look out for one another's good. Thank you, everyone. Appreciate it. Look forward to seeing you tomorrow at 1:30. Bye-bye.